Hello friends, we are today we are discussing about the eating watermelon during pregnancy, its benefits and drawback also. Watermelon is an hydrating fruit with a different potential benefits during pregnancy. It may help reduce swelling, minimize pregnancy related complications, alleviate morning sickness and contribute to healthy skin. However, few of these claims are strongly supported by scientific evidences. This article reviews research to determine whether watermelon offers any specific advantage for pregnant women. Firstly, we see the nutritional profile of the watermelon. Uh, it is a main source of the carbohydrate, vitamins, minerals, and beneficial plant compound. It is composed of 91% of the water. It is an excellent fruit for hydration. This, it is a Now we discuss about the nutritional content. If we taken 115 grams of watermelon, it provides 46 calories, protein 1 gram, fiber is less than 1 gram, fat is also less than 1 gram, carbs are 12 grams, vitamin C is 14% of daily value, and copper is 7% daily value, vitamin B5 pantothenic acid 75% daily value, provitamin A 5% daily value. And watermelon is also rich in antioxidant like lutein and lycopene, which protects the body against damage and disease. These antioxidants may support eye, brain, and heart health and potentially reduce the risk of certain cancers. Some studies suggest that this specific antioxidant might lower the risk of premature birth and other pregnancy related complications. However, more research is needed to confirm these findings. Number two, we see about the benefits of watermelon for pregnant women. Is eating watermelon good for pregnant women? The answer is watermelon has often been considered a sweet and refreshing treat with limited culinary and nutritional value. However, it is actually a versatile and highly nutritious fruit. In salads, watermelon add crunch and a vibrant color to dishes. In smoothies and sorbets, it serves as a naturally sweet and refreshing base. Watermelon also enhances the flavor of savory barbecue sauce. If you are pregnant and the benefits are even more significant, watermelon soothes heartburn and reduce swelling. It is high water content in 91 to 92% and its natural sugar can help reduce morning sickness and dehydration. And the mineral it contains may help prevent muscle cramps during the second trimester of pregnancy. According to research experts, watermelon contains more lycopene than tomatoes, an antioxidant that fight cancer and cardiovascular disease, boost the immune system ability to fight infection, and naturally increase the skin SPF. Here are some benefits during pregnancy. Watermelon may reduce the risk of preeclampsia because it is rich in lycopene, a compound found in the tomatoes and other similar colored fruits and vegetables. Some studies conducted with watermelon have shown that consuming 4 mg of lycopene per day, or about 60% of the lycopene found in the 1 cup, that is 150 grams of watermelon, can reduce the risk of preeclampsia by 15%. Preeclampsia is a common pregnancy complication characterized by high blood pressure, swelling, and a protein loss in urine. It can cause severe issue for both the mothers and baby and is the leading cause of premature birth. Based on research that found lycopene supplementation could reduce the risk of preeclampsia, watermelon, which is rich in lycopene, is often promoted as a way to protect women from developing preeclampsia during pregnancy. However, more recent studies have found no connection between watermelon consumption and risk of preeclampsia. These studies use high dose lycopene supplement to provide lycopene, not watermelon. Therefore, there is currently no research linking the consumption of watermelon during pregnancy to reduce the risk of preeclampsia. Second point is watermelon may reduce the risk of pregnancy complication or side effects. During pregnancy, a woman's daily fluid needs significantly increase to support optimal blood circulation as well as their higher amniotic fluid and overall blood volume. At the same time, the digestion process tend to slow down. So, should pregnant woman eat watermelon? This combination of changes can increase the risk of dehydration in pregnant women. Conversely, this can increase the risk of constipation or hemorrhoids during pregnancy. Suboptimal hydration during pregnancy may also be associated with poor fetal development and as well as higher risk of preterm birth and birth defect. The abundant water content of watermelon can help pregnant women better meet their increased fluid needs, which may reduce the risk of constipation, hemorrhoids, and pregnancy complications. However, this can apply to all fruits and vegetables rich in water, including tomatoes, cucumber, strawberries, and even broccoli. Therefore, while technically correct, this benefit is not exclusive to watermelon. Number three, watermelon helps alleviate heartburn symptoms. Pregnant women often experience digestive issues such as heartburn. Watermelon helps ease this problem by smoothing the esophagus and stomach, providing immediate relief from heartburn. Number four is reduced swelling. Mild swelling in the hand and feet or edema is a common during pregnancy. The high water content in watermelon helps to reduce congestion in the veins and muscles. That's why it is important to in treating edema. Number five is the reduced morning sickness. Drinking a glass of fresh watermelon juice in the early morning is a great idea during pregnancy. Watermelon provides a light and a refreshing experience throughout the day. Its energizing and nutritional properties also help alleviate morning sickness. Reduce number six, reduce muscle cramp. A pregnant woman body undergoes many changes, increasing weight and hormonal fluctuations can lead to muscle and bone pain. Including watermelon in any form helps the body cope with prevent pigmentation. Number seven, pigmentation is a common skin issue during pregnancy, which can take away some of the joy of a pregnancy. Watermelon plays an important role in preventing skin pigmentation issue. Watermelon promotes easy digestion and keeps bowel movement smooth, which affects the texture of a skin, making it glow and beautiful. Number 8 is diuretic and detoxifying effect. Watermelon has diuretic properties. It helps flush harmful toxin out of the body. Additionally, watermelon stimulates kidney functions, detoxify the liver, and reduces uric acid level in the blood. Our main point number 3 is safety concern when consuming watermelon during pregnancy. It is safe for pregnant women to eat watermelon. Eating watermelon during pregnancy is generally considered quite safe for pregnant women. However, this fruit is relatively high in carbs and low in fiber, a combination that can cause blood sugar spike. Therefore, women with pre-existing diabetes or those who develop high blood sugar during pregnancy, known as gestational diabetes mellitus, may want to avoid consuming large portion of watermelon. As with all fruits, watermelon should be thoroughly washed before being sliced and eaten or refrigerated immediately. To minimize the risk of food poisoning, pregnant women should also avoid leaving watermelon at room temperature for more than 2 hours. Watermelon is a nutrient dense fruit with many beneficial compounds for health. Regular consumption during pregnancy can help reduce the risk of developing preeclampsia, constipation, or hemorrhoids. Its high water content can also help reduce the risk of poor fetal development, premature birth, and birth defect. However, the evidence supporting some of this benefit is weak, and in many cases, they may apply to all fruits, not just watermelon. While it is often promoted as offering a long list of the additional benefits during pregnancy, none of these benefits are currently scientifically proven. This suggests that watermelon remains a nutrient rich fruit and great way to add variety to pregnant woman diet. With the information about now the benefits and drawbacks of eating watermelon during pregnancy. For any concern, especially doctor will provide advice to ensure you have a healthy pregnancy. Thank you.